I'm Joe Geenen. I'm a physician, a gastroenterologist. I'm director of the Pancreatic Biliary Service at St. Luke's Hospital in Milwaukee. I'm also a clinical professor of medicine at the Medical College of Wisconsin. We see many patients who have pancreatic cancer that are referred to us at St. Luke's. And most of the time, it's because they have symptoms, and at that stage, they're inoperable in over 90% of patients. And 95% will die within a few years. So this really motivated us to try to find something that we could do, that we could identify these people before they develop cancer so that we could help these people. As you are aware, many families who have a history of pancreatic cancer, it's almost a death sentence if they get it. So they're extremely concerned about pancreatic cancer. And if we can offer them something to assure them that they don't have pancreatic cancer or that it's early in the disease, that we can cure them, I think it makes them feel much more comfortable. We are looking for a new method to try to diagnose this early and give people some hope that they can survive pancreatic cancer so that we can diagnose it early before they have symptoms, and then we can cure many of these people. Now we're looking at a group of patients who have a high risk of having pancreatic cancer. These are people with familial pancreatic cancer. That means people who have 2 or 3 relatives with pancreatic cancer. And we're looking at some hereditary or familial conditions such as chronic pancreatitis, Putz-Jaeger syndrome, Lynch syndrome, people who have breast and ovarian cancer and have a relative of pancreatic cancer, and even people with malignant melanoma have an increased incidence of pancreatic cancer. So we're looking at this high-risk group, and this accounts for about 10% of all pancreatic cancers, and if we can diagnose it before they have symptoms, we can cure many of these people. We're starting this initiative, and we're trying to let people know that there is a hope and that we can help people that have early pancreatic cancer and save them from dying of pancreatic cancer. What we do, we have a program where you can call a program coordinator, get involved. The patient is then sent to a genetic specialist who decides if it's really worthwhile to screen these people, and then they're referred to a gastroenterologist, and they have endoscopic ultrasound, which can detect early pancreatic cancer, where we pass a scope, an endoscope, where we can look through the scope and pass it into the stomach and near the pancreas, and then we do an ultrasound of the pancreas, and we can tell if there's any lesions there. We can tell if there's any swelling or cystic lesions or even abnormalities, minimal abnormalities, and we can do a fine needle biopsy and see if it is cancer, and if we do find it, we can biopsy it possibly, and patients can go to surgery. And we've got some studies that suggest that we can cure many of these people before they develop severe pancreatic cancer or have symptoms.